Dr. Bayrak, I've been hearing the words AMH. What does that mean, and do I need a test for that for fertility?
AMH stands for anti-Müllerian hormone, and it can be measured anytime during your menstrual cycle. So it's not like FSH and estrogen, where it has to be measured on the second, third, or fourth days of your menstrual cycle, but it can be done at any time.
When I am testing for my fertility, what day is the best day to see my fertility specialist?
That's a good question in two parts. So basically, if you have irregular cycles, meaning your cycles are difficult to predict every 2 months or 3 months, then the testing needs to be done randomly, and your AMH level can be measured randomly. If the cycles are predictable, meaning you're going to get your period next Tuesday, Wednesday, then the best option is to come in on the third day. If it's not possible for you to come in on the third day, then on the second or fourth days, you can come in and measure your FSH, follicle stimulating hormone, your estradiol, and the anti-Müllerian hormone level.
Should I be testing for AMH if I am struggling with fertility?
Absolutely. If you're struggling from conceiving or from fertility issues, anti-Müllerian hormone is the most basic test, and it's an important test because it tells you where you're at with your egg reserve. And you might be really young, 27 or 28, or you might be 37 or 40 or 42, and the AMH anti-Müllerian hormone level is going to tell you how soon you should start fertility treatments and how urgent it is that you start the fertility treatment sooner or later.
Am I able to improve my AMH levels?
In general, the answer is no. You're not able to improve your AMH levels. The only exception to that, if you are on birth control pills for a while. A while means 3 months, 6 months, or a year or longer, and your AMH level is low. Then we take you off the birth control pills, and in 2 months, 4 months, or 6 months, we measure your anti-Müllerian hormone level, or AMH level. But at the same time, we do an ultrasound to count or measure and document the number of antral follicles, which will then give us information about your egg reserve along with the anti-Müllerian hormone level.
So let me get this clear. When I go to a fertility specialist, what are the tests I will get at this first consultation?
At the first consultation, if you're on your period on the second day, third day, or fourth days, an FSH level, follicle stimulating hormone level, estrogen level, or typically called the E2 level, and the anti-Müllerian hormone level, the AMH hormone, is then measured. If you have irregular cycles, let's say your cycles are every 40 days, 50 days, every 60 days, or every 2 to 3 months, then randomly, the testing can be done, but the FSH and the estrogen levels won't be accurate, but the anti-Müllerian hormone will always be accurate.
But are you doing an ultrasound on that same day as well?
Exactly right. On that same day, an ultrasound is accompanying the blood testing, and it would give us information about your egg reserve. Now, in women who have regular cycles, that would be very accurate. In women with irregular cycles, you're going to do the testing randomly. The testing will also give you information about the egg reserve, but it will most likely be a higher level, a higher antral follicle count, and that's why it won't be as accurate as somebody who's getting her periods on a regular basis, regular time period.
That's helpful to know. What if my AMH is low and I'm unable to improve my AMH level? Can I still get pregnant?
The short answer is yes, you can still get pregnant based on your age group if your AMH, anti-Müllerian hormone level, is low. That means that your egg reserve is low. Whether you have irregular or regular cycles, your egg reserve is low. In that case, testing for the additional hormone levels and your infectious diseases and everything in the shortest amount of time would be recommended, because your AMH level is low, which then equals to your egg reserve being low, and that's going to affect everything. Thank you, Arba, for all the questions. We want to continue these questions for our YouTube channel. For our viewers, if you have your own questions that you're curious about, you can submit your questions on our website, www.laivfclinic.com, under Ask Dr. Bayrak. See you in the next video.